and they're sensitive to everything. They can't keep down certain foods. So just know that I want you to know that if you get implants, there are a lot of consequences that are not shared with you in allopathy that I talk about in this book. And breast implants don't just affect some women. They affect women differently, and it's on a scale, you know, it's on a big spectrum, but they impact every woman negatively in some way, shape, or form. So you can do fat transfer. Yes. Which is what I did with my breasts. I rebuilt my breasts with fat transfer. I love them, but they would have been about the same size anyway. And every woman that I've talked to, when you get breast implants after you've had them removed, they just never feel the same. So just know that there are other alternatives other than breast implants, but you're going to get the peer pressure from these doctors who we have been trained to believe are God, and we're too stupid to know anything else, and that there are other solutions. And if you bring this book to these types of doctors, they might poo-poo it and say, you know, that she doesn't know anything. She's not a doctor. So this is where you get to check in with your own intuition. And you might not get the support either from your peers. You might not get the support from your friends or your significant other. They might say it's all in your head because you look healthy, or, you know, it's all in your head, anything. So there are many other solutions. You're not in a hurry, and the book will provide you a lot of options that you can consider outside of just getting implants.
Okay, so let's talk about two things. And I really like your analogy about, you know, when you get the implant, I always say it's like a sliver under the skin, right? It's an irritation, and the immune system's reacting because it's a foreign body, right? It's trying to get it out, to do something. So right. When the immune system in the body's reacting like that, it produces that, what is it? The capsule. The capsule. Yeah. So tell us about the capsule and why it's so important to have that removed when we do an explant.
Yeah, and you're going to hear different things from doctors on whether or not it's important to do an end block with total capsulectomy. So what that means is, I talk about this in my book. It means that this is what it looks like right here. And this is not in color, but this is in the book. So those are my implants, of course, that you could see on the jelly looking things. Mm-hmm. And then the hamburger looking ones is proof that the body develops an autoimmune reaction to the implants and creates a wall to defend ourselves from these implants. And when the doctor knows what they're doing, they can remove the implant intact first. So let's imagine using that hamburger analogy, right? So the jellyfish donut, let's just say jellyfish and the hamburger, right? So when the doctor goes in and opens you up, when you have a proper explant, and I talk all about this in my book, I talk about all of this in my programs because it's a learning curve. And like I said, you're going to have doctors that might say, oh, it's not that important to remove the whole capsule, but that's the equivalent of doing a root canal and not removing the dead tooth, because then you're going to have this dead object rotting inside of your body. And when it's rotting inside of your body and there's been a seal on it, there's no way that any amount of antibiotics will ever get to it because it's sealed off in a pocket. And that allows those bugs to thrive, which means that you don't feel like you're surviving. You're in survival mode, right? So what it means to have an end block explant is a doctor who's skilled, and I have a whole list of them on my website. When you provide the link, it has resources galore. So if you're just like, oh, where do I start? Dr. V will give you the link on where to start, right? And it's just like, my book goes for anywhere between $10 or $15. And then you have like resources upon resources. I give you guys a lot of this stuff because it can be complicated, right? So, and I'm also an admin of a group too in Facebook. So you guys can get on there as long as Facebook hasn't censored us from the topic, right? Because there's been a lot of groups that have been censored. Right. So the right doctor who knows how to do these things properly, a lot of them have 1-year wait lists, but I also have some doctors that I've teamed up with that I could refer you to that don't. So they go in, they cut you open. And first they're going to have you do a lot of scans and things to do some scannings before, like MRIs and ultrasounds. Please be very mindful about having a mammogram done because mammograms have a higher likelihood of rupturing your implant. So be very mindful of that. And I'll just leave that for now, just as a seed plant for you to research in my book later, because we in the essence of time. So what they do is they open you up, and provided that your implants are not ruptured already, then you will just have the hamburger with a breast implant inside. The doctor will perfectly with precision be able to cut around the implant and remove the implant and in the form of a hamburger. And that's important because if that doctor cuts open part of the capsule, then if the implant has ruptured or bled, which many of them have bled, but if it's ruptured, even worse, because what happens is that any kind of mold or the 10 plus average bacteria that a woman has between that capsule and the implant will leak out and travel throughout her body. Mm-hmm. And then she can get very ill. So having a doctor who is skilled at perfectly cutting it open and removing the hamburger, that's what you want. Then I just had a couple of clients this happened with that I'm working with on my Explant detox. The doctor will cut open the hamburger, like you saw that picture next to where you can see my implants and that little piece of red tissue. Mm-hmm. That's the capsule that he cut open. My implants were not ruptured, but many women I work with, their implants have been ruptured and they didn't even know it. So then when the doctor cuts it open outside of her body, and then it's like, you know, just oozing everywhere, as you imagine if you open up a jelly donut and it's just like oozing all over the place, right? Mm-hmm. So this is what happens to a lot of women. And I see a lot of women when I do their GI panels that they're full of bacteria. They're full of not just, you know, the bacteria, you know, little candida here and there. They're filled with opportunistic bacteria that they're very ill from. And doctors don't know to look for this stuff, which is why I say, if you're going to work with any doctor ever, have a doctor like Dr. V. They have 3 E's: empathy, because they've gone through it themselves; experience, they've worked with hundreds of women who have gone through the same thing; and education. They know exactly where to go, what to do, what to test, and in what order, and then how to treat it in what order. So you're not spending tens of thousands of dollars. So that's very important to work with a doctor who knows how to remove it properly. And then also to have a coach or someone to help you prepare for that surgery, help you detox after, because step 1 is to remove it. But women stop there and they're like, okay, I removed the implants, I'm done. That's like saying I removed your mercury fillings and that's it. Those mercury fillings have been traveling all over your body for as long as they've been in your body. So it's very important, equally important to detox after and to heal the tissues. Does that make sense? Did I cover what your question was, Dr. V?
Yeah, no, that's great. Great information.
Yeah.
Now, okay, so they don't want to do silicone implants. You've convinced them that they're toxic.
Or saline.
What about the fat transfers, right? I've heard so much information that it's the latest and greatest. And I think Suzanne Summers did fat transfers.
Yeah.
She's an advocate for that. So what kind of issues can women expect with that? And are there any?
Yeah. So the fat transfer is something that now is the most popular, right? So I'll show you a picture, and I have tons of pictures in my book. So here's a little picture of me before. So you can see my breasts were crooked, asymmetrical. My cleavage wasn't perfect. So, you know, that was done before. And then I had breast implants. They were about double D at that point, really inflamed. And then the bottom one is after about 6 weeks, I think, after my fat transfer. Okay. And I was all excited. I was like, yay, my breasts are going to look beautiful. There were 100 cc's to each breast. And most doctors will tell you, and I'm always going to be real with you guys. Most doctors will tell you that you're going to retain between 75 to 80% of that fat transfer. That is not always correct. It depends on the woman. It depends on her frame. It depends on what you do after and before your surgery. So my role is to help women prepare for their surgery so that you can retain as much of it as possible if you do fat transfer. And to know, you know, a lot of women in my tribe anyway, they're a lot like me, right? You track your vibe with your tribe, and a lot of them are like, I got to work out after because now I'm excited to do push-ups again. And I'm like, hold on.
Well, where did you get the fat? You're so thin.
Exactly. So, right. So a lot of the women that I work with, and I work with women of all shapes and sizes and ages, right? So with women who have like over 25% body fat, sometimes they're real thin, and you're like, where is the fat coming from at 25? And that was me before I even was a bodybuilder, a bikini competitor. And so it's hard to harvest. It sounds like a really weird word, but harvest fat and transfer it. So I had fat removed from, my waistline here, and I had it from my little pooch belly and my inner thighs, and then some from my lower back flanks. So admittedly, I was like, oh, and I'm really happy with my body after, because these were some of my problem zones. I don't even like to use that word problem zones, but that's conventional words, right? But that's where my body would store extra energy. So I had fat moved from these areas, those 4 pockets. Some women have enough fat from their arms to place them here to rebuild their breasts. So I'm very pleased with my results, but I just want you all to know that if I would have done it, if I could have done it differently, here's what I would have done. And for many women, they're so sick. They're so sick from their breast implants, but plus, of course, life too. I mean, it's not ever just one thing. And I talk about this in my book too. A lot of women aren't even eating healthy. They're drinking lots of wine. They're not taking very good care of themselves. I call it your inner bully bitch. You're being really mean to yourself because our culture has taught us to be very loathful inside of our own mind. So it's not just the breast implants. And that's why I like to teach women, like, let's clean it up before you do this. But breast implants are a big part of it. So, when you do this, if you do this, if you do an explant, if you're at the point where you're really exhausted, you've tried a lot of things, you've worked with a lot of doctors, and you would consider yourself a little bit more advanced, I would have done it this way. Get the explant first, maybe a lift at the same time. Give yourself 6 months to a year. See how your breasts look and feel. I mean, I always say if you were more than a C, if you had more than like 250 cc's, you might need a lift. If you've had them in for a long time, you might be downward facing nipples. You might need a little bit of a lift because the implants pulled your breast down with gravity. Most women do get a lift. And then 6 months to a year later, then after you've detoxed, then do the fat transfer, because it's a lot of work to recover from just that one explant surgery. So then the fat transfer is another surgery. Yes, you'll pay more money to be put under, but a lot of women have regretted doing fat transfer first without first seeing how they looked just doing a lift. And a lot of women are very happy just doing the lift.
Okay.
Yeah.
And what kind of side effects can women expect when they do a fat transfer? Like, is there a risk of infection or?
Yeah, not so much infection, but seromas are very common. So seromas, and we'll cover this in my podcast with you too, Dr. V, and maybe you could even do a side video. I don't know, but seromas are little pockets of basically scar tissue inside of our breasts, where if you've had fat transfer where you have fat transferred into your new breasts, minus the implants, then it's fat that goes, wait, I was moved into another area. And so it doesn't always take, because it doesn't have a blood supply. So if you're not doing proper lymphatic drainage, so I teach a lot in my program, proper drainage techniques that you do every single day to get your lymph moving. And the majority of us have never been taught to focus on lymph. And we've got over 600 of them all throughout our body. And especially the most of them are around our breasts and our armpits. So that's important first to do that. If you have more side effects from fat transfer, if you don't prepare your body for proper blood flow and circulation. And the majority of us have so many scars around our body. We have circulation problems. We have stagnant lymph. We have fascia, the fascia and the lymph are connected. So I talk a lot about the preparation for that, so that if you do fat transfer, it reduces some of these side effects, but still, no matter how prepared that you can be, and I consider myself very prepared, there still is a lot of these lumps that I have. And so when you have a lot of lumps, it also can feel, like you said, Dr. V, like it's like your breasts don't even feel like they're a part of you anymore. They're beautiful, but they don't feel like they're a part of me. They kind of feel like they're numb a little bit. You could also carry, it's a very painful procedure to do. And I would say, other than that, there's not a lot of terribly negative side effects other than the scar tissue here. And then when you have scar tissue here and the seromas, the fibrocystic breasts, then you can't properly circulate and your lymph is stagnant here. So you have to focus on lymph flow outside of where you otherwise had it here for the rest of your life. And very few, if ever, any woman is properly trained on how to keep her lymph flowing after that, because now this is now a traffic jam. These breasts are now a traffic jam with fat transfer. And that won't ever change, because a lot of times I've done a lot of PRP, because you've got these like the big balls of what feels like gum in your breasts, a lot of PRP, and it's helped, but that's cost a lot of women money.
What's PRP?
PRP is when you have your plasma pulled. So a doctor will pull blood from you and they'll spin it and separate the plasma. And then what they do is they inject that back into areas where you might need it. So a lot of women are
Okay.
doing, Botox or injectables. You could do PRP on your face to hydrate, regenerate, increase circulation too, heal scar tissue. And I've done that because I was looking like I was 10 years older in like 2 years when I had my BII journey. And now my face looks a lot younger and my face glows again. I did do some PRP on my face to regenerate a lot of that collagen because about a third of women attack our own collagen when we have breast implants. And so when you lack collagen, your connective tissues, your face, your breast tissue, a lot of it just can't connect. Your bones feel like they're just falling apart. So PRP it's not cheap. It's about $350 per location. So if you're doing 2 breasts, then that might be $700, and you're doing that once every 2 weeks or so. So I try to minimize